So I've got my sterile gloves on. My left hand is going to become my clean hand. My right hand will remain as my sterile hand because I'm right hand dominant. My patient's still on 100% oxygen. I've looked at the vital signs. The vital signs are normal for the patient, so they should be able to be suctioned. There's no contraindications right now to suction this patient out. So the first thing I'm going to do is I'm going to break sterility with my left hand, and that's going to become my clean hand. So I'm going to grab my suction setup like so. I'm going to remove the suction catheter from its plastic sheath, grab the tip of the suction catheter with my right hand, which is my sterile hand, my right, your left, and I'm going to lubricate the end of the catheter like so in the sterile area and make sure I've got suction. Now what I'm going to do, perform a simple bend like so without kinking off my tube or my catheter. I'm going to go to the patient, I'm going to remove them from the ventilation. So sir, you're going to miss a few breaths while I suction out your secretions from your tube in your throat. So disconnect the patient from your ventilation source, like so. Take your suction catheter, ease it down the patient's endotracheal till it stops, pull back, apply suction, and remove the secretions, not kinking off the catheter in the process. Put the patient back on ventilation, make sure they're being ventilated, clean out your suction catheter. Make sure you're not contaminating the suction catheter. Now before the next breath, I'm going to put my stethoscope in my ears, like so. I'm then going to listen to the patient. Now you have to note the proximity of your suction catheter to anything that might be contaminated and not touch anything that could wreck the sterility of your right hand or whatever hand you're using to control your suction catheter. So take a listen to your patient's chest. Big breaths. They're getting the breaths from the ventilator. Oh, they still have secretions in there. I need to suction them out. Plus, I can still see the secretions inside the endotracheal tube. So let the ventilator deliver at least 2 minutes of 100% oxygen breaths. Make sure the patient's vital signs on the monitor look fairly stable for that patient, that they're not throwing any kind of arrhythmias that are dangerous for them, etc. And when you're ready, you can suction them out again. Remember, maintain sterility with whichever hand is your sterile hand. Don't leave the catheter dangling like this, because it can cause problems for you in the future. So, lubricate again. I'm going to take my suction cap, or my stethoscope, place it around like that so it's not dangling and hitting the patient or wrecking my sterility. Patient's still on 100% oxygen. They're stable. Okay, sir, going to disconnect you from the ventilator, and you can suck all those secretions out of your breathing tube again. Disconnect them. Take the suction catheter down the endotracheal tube, advance it till it stops, pull back, apply suction, remove the secretions. Off, back on the ventilator. Ventilator's going to give you some breaths again, sir. Wait for the patient to recover. He's still on 100% oxygen. Going to take another listen to his chest. All the way down. He's nice and clear. So now that he's nice and clear, I pretty much can go now and suction out their oral pharynx. So I take a brand new suction catheter, and I don't have to remain sterile for this particular procedure, but I take a brand new suction catheter. Here's a brand new suction catheter, never been used before. I'm going to place it on my suction, like so. I'm going to lubricate it. Now you can lubricate it back in that solution, or you could find your bottle. Make sure everything falls for you. Find your bottle. And again, I'm not sterile any longer. I'm going to take my new catheter, lubricate it in this bottle, because this bottle is not considered to be sterile any longer. And if I was going to nasopharyngeal suction the patient out, I'd simply tell them that I'm going to go down their nose and put the catheter in the back of the throat and suction the secretions from there. So sir, I'm going to go down your nose, advance it slowly straight back. There we go. And I can see the catheter behind the uvula. So now I'm sucking all the secretions out of the back of the pharynx. Now because I'm in the back of the pharynx, I can actually turn my suction regulator to line. And I'm cleaning all the secretions out of the back of the pharynx. Once all the secretions are out, pull the catheter out, and clean your suction catheter. Okay? Now if you have to go down orally, what you could do is take the suction catheter, tell the patient going down orally, sir, I'm going to go down the back of your throat now through your mouth and remove all the secretions that are back there. Gently put the catheter in the back of the oral pharynx like so. You don't have to go down too far because the pharynx is right there. Apply suction and suction all the secretions that are coming up from the back of the pharynx. Once you've done that, remove the suction catheter, clean out the catheter, clean out your suction tubing. At that point in time, make sure your patient's